So today's topic is prerequisites to treat acute and chronic cases. Okay, what we need to know before treating any case, acute as well as chronic case. For that purpose, I will share with you few aphorisms which will tell us what is important before treating any patient, any individual. So before that, I will like to give a tribute to Dr. Samuel Hahnemann, as today is the birth anniversary of Dr. Samuel Hahnemann. Samuel Hahnemann has very clearly mentioned all directions and all rules and regulations for us, which are necessary for us to treat any kind of disease, whether it is acute, chronic, in chronic also mental disease, local disease, any kind of disease, epidemic disease, endemic disease, any kind of disease we can treat if we follow these directions given by Dr. Samuel Hahnemann. So let us first start to understand what is disease by Dr. Samuel Hahnemann. So in this aphorism number 3, Dr. Samuel Hahnemann says that if the physician clearly perceives what is to be cured in diseases, that is to say in every individual case of disease. That means when we take a case and we collect symptoms from patient, from accompanying person, and which we observe, from those symptoms, we should be able to understand what is to be cured in diseases, in acute as well as chronic. So what is to be cured in diseases? We know this aphorism. These 3 points are given in this aphorism: knowledge of disease, knowledge of medicine, and knowledge of application. So what is to be cured in diseases? That is to say in every individual case that we have to know. Second point is what is curative in medicines? That is to say in each individual medicine. What is curative in medicines means how we will be able to know what is curative in diseases, what is curative in medicines. By Matra Medica, through Matra Medica, we will be able to understand what is curative in medicines. So for that purpose, we need to know each medicine, and for that we need to refer the main source books of Matra Medica, which have provings of various medicines. Okay, so this will tell us about the what is curative in medicines. Third point is how to adapt according to clearly defined principles what is curative in medicines to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue. Okay, so third point is how we will be able to, or how to apply this knowledge of disease and knowledge of medicine during practice, and how this will help us to selection of a correct medicine, selection of a correct dose, and at what time we have to change the dose, at what time we have to change the medicine, what are the signs of amelioration and aggravation. All this is called as application of this knowledge of disease and knowledge of medicine. So in this aphorism only, in further, just a minute, slide is not moving. So in this aphorism only, Dr. Hahnemann says this application in detail, like the suitability of the medicine most appropriate according to its mode of action to the case before him. That means choice of the remedy. He tells about the choice of the remedy. This knowledge of medicine will help us to select the correct medicine from source books, as also in respect to the exact mode of preparation and quantity of it required, proper dose. So what dose we have to give, this also physician should know what dose we should give, how much should be the repetition of that dose, all these things, and what is the minimum dose required for the particular case of disease. So all this comes in application. So we should be able to know all these things so that we will be able to uh, cure a case in present in front of us. In if finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent. So what three things we need to know? We should have knowledge of disease, medicine, and how to apply this knowledge of disease and medicine in a particular case, whether it is acute or whether it is a chronic case. So in disease, what we should know, what is to be cured in every individual case, that we should know in a disease. In medicine, what we should know, what is curative in medicine, and that can be known to us by referring source books of Materia Medica. And third point is application knowledge, all this knowledge how to apply in a particular case. This will help us for the selection of medicine, for the repetition of the dose, for the preparation of the dose, and if is there any obstacle to cure in a particular case, and how to remove that obstacle. How will we be able to know whether there is any obstacle to cure or any maintaining cause or anything which is causing the improvement, which is not helping to improve a case. So for that purpose, in next aphorism, in aphorism number 5 and 6, in aphorism number 5, Dr. Hariman has talked about how we will be able to know about the obstacles to recovery, like for diet, like environment in the family, environment at the workplace. All these things may maintain the disease in a patient, or may because of those obstacles patient may not improve to cure. So we will be able to know, we a physician, homeopathic physician should able to understand the obstacles to cure, and he should be able to know how to remove those obstacles so that it will help patient to improve fast. Okay, so first, in the first part, in first this aphorism number 3, we understood what is required. All organon of medicine is given in this aphorism number 3. If we know this aphorism perfectly, we will be able to practice, or we will be able to treat any case, acute as well as chronic case. So these are the prerequisites to treat any case: knowledge of disease, knowledge of medicine, and knowledge of application, how to apply that knowledge in a particular case. Okay, so let us understand now what is a disease. What definition of disease is given by Dr. Samuel Hahnemann. So in aphorism number 11, Dr. Hahnemann tells, when a person falls ill, it is only the spiritual self-acting vital force everywhere present in its organism that is primarily deranged. Means disease means a derangement of vital force. Okay, and how this derangement we will be able to observe in a patient. It is only the vital force deranged to such an abnormal state that can furnish the organism with its disagreeable sensations and incline it to the irregular processes which we call disease. So disease, we will be able to know that a person in front of us is a diseased person by this abnormal state, by these disagreeable sensations. Okay, further Dr. Hahnemann tells this, for as a power invisible in itself and only cognizable by its effects on the organism. So we will be able to understand that vital force is deranged is by only by these disagreeable sensations. Okay, irregular processes. By these sensation symptoms, morbid symptoms only, we will be able to understand that yes, the vital force is deranged. And this is the definition of disease given by Dr. Hahnemann. Its morbid derangement only makes itself known by the manifestation of disease in the sensations and functions of those parts of the organism exposed to the senses of the observer and physician. That is by morbid symptoms, and in no other way can it make itself known. Okay, so derangement of vital force will be observed by us only through and through these morbid symptoms. There is no any other way. Okay, so this is the definition given by Dr. Samuel Hahnemann. So now we understood what is disease. Now, if disease is there, then it will be presented to us by morbid symptoms. Then how to collect these symptoms? For that purpose, we should know only three important aphorisms. What are these three important aphorisms? Aphorism number 5, aphorism number 6, and aphorism number 153. Okay, this is a definition we have understood. Now, how to select symptoms or how to gather symptoms, that we will see now. So, vital force, which is spiritual, automatic, autocratic, and dynamic, is deranged because of morbific dynamic influence, and that derangement will be presented to us in the form of abnormal state, irregular processes, disagreeable sensations, morbid symptoms, and this is called as disease. Okay, so this disease, now how to collect these symptoms? So in aphorism number 5, Dr. Hahnemann has given clues in aphorism number 5, 6, and 153. In aphorism number 5, Dr. Hahnemann says, useful to the physician in assisting him to cure. See, the first line itself tells that this is going to help us, this is going to assist us to treat a case, to cure. Useful to the physician in assisting him to cure are the particulars of the most probable exciting cause of the acute disease. In acute disease, the most probable exciting cause, as also the most significant points in the whole history of the chronic disease, to enable him to discover its fundamental cause, which is generally due to a chronic miasm. So, in acute miasm, in acute disease, exciting cause, and in chronic disease, the fundamental cause, that is the chronic miasm, is important. Okay, so if any case comes to us in clinic, so we first have to understand whether it is an acute disease or it is a chronic disease. If it is acute, then ask for exciting cause. And if it's a chronic disease, then try to understand what is the fundamental miasm behind this chronic disease. Okay, in these investigations, the ascertainable physical constitution of the patient. See here, patient, Dr. Hahnemann has given, mentioned the word physical constitution of the patient. Okay, not a mental constitution. Okay, ascertainable physical constitution of the patient, especially when the disease is chronic, his moral and intellectual character, his occupation, mode of living and habits, his social and domestic relations, his age, sexual functions, etc., are to be taken into consideration. Okay, so first thing Dr. Hahnemann has told us to consider is exciting cause and fundamental cause. Exciting cause in acute disease, fundamental cause in miasmatic cause in chronic disease. Second point, what he has told, we have to consider all these things like physical constitution, his moral, intellectual character, his occupation, mode of living and habits, his social domestic relation, his asexual function. Okay, all these points will help us to understand the development of that particular individual. Okay, his intellect or his ability to respond to the stimulus. Okay, all this will help us to understand this development of that particular deceased individual. All these points will also guide us to understand what can be the obstacle in the in that particular case, whether is there any problem at family environment, or is there any problem at occupation level, or is patient is habituated to few drugs or few uh, things which are unhealthy for the uh, him. All these points will help us to understand obstacles to cure. Okay, so these things will not help us to repertorize a case or to make a totality, but this will surely help us to understand the patient's development, or it will surely help us to understand the obstacles to recovery. Okay, so that we can help that patient to come out of those obstacles to by through some counseling or through some therapies which will help us, or which will help that patient to get recovered fast. Okay, so in aphorism number 5, the main thing given by Dr. Hahnemann is cause. Okay, exciting cause in acute disease, chronic fundamental cause, miasmatic cause in chronic disease, and other points will help us to get patients recover fast from his disease state. Okay, so in next aphorism number 6, in aphorism number 6, Dr. Hahnemann has told us what actually we have to consider in a case taking. In a case, what actually we have to consider. So what Dr. Hahnemann says, the unprejudiced observer, well aware of the futility of transcendental speculations, which can receive no confirmation from experience, be his powers of penetration ever so great, takes note of nothing in every individual disease except the changes in the health of the body and of the mind. Okay, understand this sentence. The unprejudiced observer take will note will take the note of only the changes in the health of the body and of the mind. Okay, he will not consider the things which have not changed. He will consider only things which have changed. Okay, which can be perceived externally by means of the senses. That is to say, he notices only the deviations from the former healthy state of the now deceased individual. Okay, so these deviations homeopath will consider, and not the regular things, like patient is like mild when he is healthy, but if during disease state he has become irritable, he has become anxious, he has become violent, then we have to consider that changed state of the mind and not the regular state of the mind which is present during the healthy state. Okay, so Dr. Hahnemann says unprejudiced observer will take note of the changes in the health of the body and of the mind. He notices only the deviations from the former healthy state of the now deceased individual, which are felt by the patient himself, remarked by those around him, and observed by the physician. All these perceptible signs represent the disease in its whole extent. Okay, all the changes, deviations are the signs represent the disease in its whole extent. That is, together they form the true and only conceivable portrait of disease. So all these deviations will form the portrait of disease. So in aphorism number 5, Dr. Hahnemann says we have to consider the cause. In sixth aphorism, Dr. Hahnemann says we have to consider only the deviations. Okay, only the deviations we have to consider at the level of body as well as at the level of mind. Okay, so Next aphorism number is 153. Okay, only these three aphorisms, if we remember, we will be able to understand what we have to treat, or what in the knowledge of disease we saw what is to be cured in a disease, that we will be able to know if we remember these three aphorisms: aphorism number 5, 6, and aphorism number 153. In aphorism number 153, Dr. Honeyman says, in this search for a homeopathic specific remedy. Homeopathic specific remedy, not a specific remedy like for ureteric calculi, Berberis is given, for hemorrhoids, Aeschylus is given, or sulfur is given, not like that specific remedy. It is a homeopathic specific remedy, means the remedy which is a simillimum, or which is suitable when the symptoms presented by the patient and the symptoms present in medicine are matched, then that remedy is called as homeopathic specific remedy. So in the search for a homeopathic specific remedy, that is to say, in this comparison of the collective symptoms of the natural disease with the list of the symptoms of known medicine, in order to find among these an artificial morphic agent corresponding by similarity to the disease to be cured, the more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case of the disease are chiefly and most solely to be kept in view. Okay, so what we have to, in aphorism number 6, we have seen what we have to consider: the deviations. So all deviations we considered, all deviations we collected from the patient. Now in that also, all these symptoms we have collected, but in that also what we have to consider the most: the striking, singular, uncommon, and peculiar signs and symptoms. Striking, which are very prominent in patient. For example, the particular type of pain which is very prominent, which has very characteristic modality. Okay, so that type of pain we have to consider. Singular. Okay, singular, uncommon, and peculiar characteristics, signs, and symptoms we have to consider. And the more general and undefined symptoms, loss of appetite, headache, debility, restless sleep, discomfort, and so forth, demand but little attention when of that vague and indefinite character. If they cannot be more accurately described, as symptoms of such a general nature are observed in almost every disease, and from almost every drug. So what we have to consider in all these collected symptoms is striking, more striking, singular, uncommon, peculiar characteristic signs and symptoms, and not these general symptoms which are not very much marked, or which are presented in a very vague form. All these symptoms we should not consider for the selection of homeopathic specific remedy. Okay, so these three things we have to remember. These three things we have to remember: cause, deviations from the healthy state, and characteristic symptoms. Exciting cause in acute disease, fundamental cause miasm in chronic case. Symptoms means what? Changes in the health of the body and of the mind, deviations from the former healthy state. Okay, deviations. And in that also we have to consider striking, singular, uncommon, peculiar, and characteristics. These three points will help us to understand what is to be cured in a disease. Okay, what is to be